Welcome, and thank you so much for joining us today live or on the recording for episode 24 of Dr. Jeff Talks About Sex and Intimacy, Vibrators, Pleasure, and Sexual Wellness. It means a lot to me that you take time out of your busy schedule to learn more about this subject. You are so welcome here, and I am so glad you joined us. We are on social media. We're out there on Facebook. We're on YouTube. We're on X. And welcome to our Kick viewers. We've been on Kick for a couple weeks now. If you're a Facebook person, we do need followers on Facebook. Please follow us on Facebook because we can do more live things that way. And we really appreciate your following us. Go to the website. The website has all of the amazing episodes that we've done so far. And we have had some wonderful hosts. Wonderful guests. Host, that's me. But wonderful guests. And I wouldn't want you to miss some of those really good episodes. You can go to the calendar and see what's coming up in the upcoming weeks. And we are scheduled out through September. So we've got all kinds of great things coming. Oh, in your cars, don't forget to listen to us in your car. Wherever you are, we are. Your favorite music streaming services like Spotify, like Amazon Music, like iHeartRadio. We are there if you are there. So please join us to learn more about all these great subjects about sex and intimacy. I just want to remind everyone, as I always do, that all are welcome here. Whatever your sexual orientation, whatever your gender identity, or your relationship style, you are most welcome here on this podcast. And thank you for being here. The goal of the podcast is pretty simple. It is just to empower and enlighten you with the evidence-based scientific information that you need to make your own informed choices about sex and intimacy, and to improve your sexual health and deepen your relationship, hopefully helping you to live and to love more fully. Today we are talking about something that's often misunderstood. Sometimes it's stigmatized, but it's always worth exploring. Vibrators and their role in sexual wellness. For some, vibrators are about enhancing solo pleasure. For others, they're a way to reconnect with a partner, overcome challenges like low libido or arousal issues, or simply discover what feels good in a safe, empowering way. This isn't just about sex toys. It's about understanding the tools that support healthy, satisfying intimacy. I couldn't be more excited to explore this topic with Aleece Fosnight, a nationally recognized expert in sexual medicine. We'll break down the myths and highlight the benefits and offer practical guidance on how vibrators can play a meaningful role in sexual health for people of all genders and non-binary people and at all life stages. Aleece Fosnight, my guest tonight, is a board-certified physician assistant. She is a certified sex counselor, a nationally recognized expert in sexual medicine, urogynecology, and pelvic health. Known for her integrative, whole-person approach, Aleece helps individuals and couples navigate issues related to intimacy, arousal, pain, pleasure, and connection. She is the founder of Fosnight Center for Sexual Health and frequently speaks on topics such as sexual dysfunction, gender-inclusive care, and the role of tools like vibrators in promoting sexual wellness. Aleece combines evidence-based medical expertise with compassionate, judgment-free care to help patients feel informed, empowered, and in charge of their sexual health. I am so excited to welcome Aleece Fosnight. Welcome, Aleece.
Thank you so much, Jeff, for having me. I'm very excited to be here tonight.
I'm super excited to have you here, and what a great topic. I have oftentimes some of my local places like the Pleasure Chest and Lover's Lane, we have some wonderful people there that are so helpful to my patients. And so I always tell them, don't be afraid. It's a wonderful adventure. Go find out about all these great things. And I'm so excited that you're going to share with our audience some really wonderful information about the topic tonight.
Yes, no, absolutely. This is a topic that often comes up in my conversations when I am talking about sexual health concerns, sexual exploration with my patients, and I have a ton of tools in my office. I really want to empower my patients to be able to take charge of their sexual health and be able to touch and feel and go, do I like the way that something and right, without having to potentially even go someplace, for it. But we have some wonderful places in Asheville, North Carolina, that I often send my folks to, like Vibrators. It's a great place, but sometimes online can be a more discreet way to purchase items,
Yes.
what people are looking for, but also like giving permission. I think that's one of the most fun things that I get to do with my patients is write a permission slip, or we'll talk about like, should we even be prescribing, right, vibrators as a tool, as a prescription, as a therapy to be able to help folks really hone in to who they are and what they want sexually.
Definitely. And we do. Sometimes we're able to, there are medical vibrators, and sometimes we are able to um, you prescribe those and give those to patients. And they don't really typically require a prescription. But like you said, I think that permission is just so important. And then it opens up this whole wonderful world of fun and mystery. So we're gonna debunk some of that mystery now. So let's, without further ado, it's all yours.
Awesome. Well, I have just a short presentation to give you all tonight. I think it's really helpful in highlighting some of the things that we're trying to address, right? So, vibrators obviously is the thing that we're talking about. Pleasure is the most important thing, and optimizing pleasure. And we'll take a look at what that looks like, especially for different gender diverse individuals. So, again, no matter who you are, how you identify, or the genitals that you have, this is the place for you. We'll talk about all of that. And then, really, how does this impact our sexual wellness, and how does sexual wellness actually come into this as well? So, again, my name is Aleece Fosnight. And again, I'm the owner and founder of the Fosnight Center for Sexual Health here in Asheville, North Carolina. All right, so I love trivia, and this is one of my most favorite things to talk about is the history of vibrators. We often think about where was this invented, who kind of came up with this. And if we think about all the way back to right 6930 BC, Cleopatra was kind of one of our first ones that we have a story about. Now, whether this is fiction or if there's really a story about Cleopatra, but what she did and the stories that have been passed down is that she actually had bees that were put into a hollowed out gourd, and that those bees made a vibration to that gourd that then she used on her genitals for pleasure and sexual excitement. So, again, just a little bit of trivia there. But really, we start to see some more exploration in the vibrator in the late 1800s with this electric vibrator that Joseph Mortimer Granville started to develop. And then really kind of another classic thing that we've heard about too is probably in the Victorian era in the 1900s, right, where hysteria was running rampant around in Europe, and there was this reason for why women were feeling depressed. They were moody, they were anxious, they wanted to lie in bed all day, and they just didn't have energy for things, is because their uterus was wandering, right? And they really thought that the uterus was moving in different areas of the abdomen or even in the entire body, and that being able to help reposition and realign the uterus was the answer to these ails that women were having. Now, what the thought was back in the early 1900s, even late 1800s, was that the only way really for women to experience a true orgasm was through penetration with a partner who had a penis. So orgasms through external stimulation, or they really didn't even consider them orgasms, but it was this sensation of stimulating the clitoris on the outside of the genitals that created these paroxysmals, what they called, AKA orgasms, right? In order to realign and reposition the uterus so that women's ailments were gone away and that they felt better. Well, word got around, right? This felt good. This really wasn't necessarily, putting the uterus back into the place that it needed to be. But you can imagine, right? There was women lined down the streets, ready to have their wandering uterus repositioned. Well, Dr. Swift was the one, and you can actually see up here in that left-hand corner, or right-hand corner, excuse me, on the screen, was that there is this poster essentially of Dr. Swift saying that he could massage to help women feel better was what was that. And of course, again, having this massive amount of women lined up at his door, right? He had to hire somebody else to help him create these paroxysmal sensations for women to make them feel better and their uteruses to be put back in place. Well, you can imagine that this was a kind of lengthy task for these individuals. And what it is kind of hypothesized is that they were starting to get carpal tunnel, right? Because they were using their hands to do this. And that in order to keep up with the demand, he said, we've got to figure out a way to have a machine to actually do this. And so he developed the crank vibrator, which you can see again underneath that image. Now, I had the amazing fortune over just a decade ago to actually go to the Good Vibrations Antique Vibrator Museum in San Francisco. And these two pictures are from my trip out there. So you can actually go and see this, and they have the whole history of vibrators. It's really fascinating to see. But then we also see in the early 1900s, especially here in the United States, that these were now being pitched in Good Housekeeping or Sears order catalogs as being household appliances to make you feel better. Maybe it was for a headache or you needed to massage your shoulder, right? But really the undertone for a lot of it and what people were using these for were, again, traditionally what we think about vibrators today. Now, we also see Betty Dodson partnering up with Ms. Magazine back in the 1970s to really push for female empowerment. This is where we see the feminist movement start to come and more individuals starting to take on their sexuality and to be able to create sexual pleasure with themselves. And then in 1983, we have Vibratex that actually developed the rabbit vibrator, which again, you can kind of see their prototype here at the bottom. Right, these were devices that didn't necessarily have batteries. You had to plug them in. And you can kind of see, again, the cord here as well. But it really came to fame in 1998 on Sex and the City when Charlotte was so concerned that she was becoming addicted to her vibrator. Now, this is one of the myths that we will talk about today, too, is that can you become addicted to your vibrator? And while it can feel really good and can be a tool that you can use on your own, there is no studies, no research that says that you can become addicted to use a vibrator. The other thing that she was concerned about in this episode, and a lot of the conversations that I get with my patients is, am I not going to be able to have as good of an orgasm with my partner if I am just comparing it to my vibrator? And really that conversation looks like having an open conversation with the partner to say, maybe we need to have more communication, maybe more direction on what you're liking. And that can be a breakdown that we see a lot of times with couples. And then thinking about the 2000s and beyond and the things that we were thinking about now, is really exciting in terms of we're really breaking down a lot of the stigma and shame that there is around sex and sexuality and masturbation in particular. While a lot of people use vibrators in partnered play, the majority of the time it is with solo play. And so let's start talking a little bit more then about the statistics, because I also think that this is really important as well. There was a study published in WebMD in July of 2023 looking at how many people actually use vibrators. And so when we think about our heterosexual female identified individuals, right, just over 50% are actually using this. We see a much larger population of our lesbian female identified individuals that are using this. Gay men are also, or gay male identified individuals, just under 50%. And then also our heterosexual male identified individuals as well. Unfortunately, we don't have any study or information in this study that extrapolates more of our queer identified individuals or transgender or non-binary individuals. But in my practice, a huge portion of them are really engaging in sexual exploration with a vibrator. Now, the other thing too we have to think about is this is a huge market. And when I am talking to a lot of my patients, we have to be really careful about where we're purchasing our toys, what is the materials that it's used, and we'll cover that here shortly. But again, it's really important to understand what this sexual toy market actually looks like. And so, really, vibrators represent almost a quarter of the sex toys that are purchased. And then when we start breaking it down into how many dollars, really $2.4 billion of the US market is spent, and even up to 9.2 billion by 2020 globally could we see. And the purpose of this too is because thinking of the technology that we could potentially use. The picture here that you see is a company called Lioness, and they are one of the very few vibrator and sex toy companies out there that are using apps and AI to really help enhance people's sexual pleasure and looking at patterns and how people are actually orgasming. So it's really fascinating on how we potentially could use AI to help. Maybe somebody is getting concerned about, I don't even know where to start, right? So Chat GPT could be a great tool to type in, I am new to self pleasure and I am curious to know where the best place to start. And I want to use a vibrator, right? Being as specific as possible with those AI tools can be really great. And then again, with the Lioness, they have a whole app that connects to it, and they are starting to develop more and more of these smart features as well. We talked about sexual wellness in that very first slide presentation. And so, what are the benefits that we see with the use of vibrators? So, on the physical side of things, when we think about vibration, and when we think about vibration anywhere in the body, it's going to actually help to improve blood flow. When you improve blood flow, it actually brings blood flow into the muscle. So, if there's tension and tightness, it helps to relax. So, we're going to see relaxation of those pelvic floor muscles and more fullness and swelling in that genital area. Bringing in blood flow also can help with nerve sensation. So we think about increasing skin sensation, increasing the nerve sensitivity that's in that area, and that can be really helpful. We also know that when pleasure is starting to stimulate it, that there can be a reduction in pain. And so when somebody is potentially having pain with sexual activity, in particular, maybe pain with sexual penetration, that using a vibrator to help with warm up, with some foreplay, can be helpful in helping to relax some of those muscles. And again, it's very individually specific and not necessarily for everybody, but can be helpful too. And most of the time that the use of a vibrator is being then used in terms to be to have sexual pleasure, which could lead to orgasm or climax. And so with that, the orgasm piece of it and all of the norepinephrine and the dopamine and the oxytocin that is released during that time helps to actually reduce pain as well. And then there are several studies in research that shows that when used frequently, vibrators and reaching orgasm can actually improve your immune system as well. And that those individuals have been shown to not be as sick as often, especially during cold and flu season. And then the last one here is to strengthen the pelvic floor muscles. So when you are using a vibrator, whether it's externally or internally, and you're reaching kind of that peak in that arousal time frame where you're getting close to where orgasm is occurring, those pelvic floor muscles start to contract. And so that can aid in strengthening those pelvic floor muscles. And then when orgasm happens, those pelvic floor muscles are also spasming and contracting. So we actually see more strength in those muscles with a more frequent use of vibrators. This leads me to a question that sometimes my patients ask me as well, how frequently can I use this? And you could use this on a daily basis. I would say a couple of times a week probably can be great, but it's all up to you and what feels good in your body, what you have time for, and what are you using it for? One of the biggest things, and this leads into the mental health side of things, is right, it can reduce stress and anxiety. So this is a great way that if you are looking to complete like the stress cycle, right? We all are living in way too stressful lives. And one of the ways to actually help to reduce stress or to complete the cycle, so you're not staying in the activation state of that stress cycle, is to get aroused and to have an orgasm. And that studies do show that that's bringing down your heart rate. People have less high blood pressure. and anxiety that goes along with it. Improving mood. We do know, right, that there is these amazing chemicals that are released in the brain when orgasm happens. And so those are all mood boosting hormones with the norepinephrine. Again, that dopamine, oxytocin are great. And when you have more control over your pleasure and you are able to engage in things that feel good to you, that boosts your self-esteem as well. And also is important for body awareness. We talked a little bit, and I alluded to this earlier. We were talking about partnered play and when it comes to communication. And so, if you have a better understanding of what works in your body, you will be able to communicate that to somebody else so that you can have great partnered pleasure without necessarily, again, comparing the two and thinking, well, I can only have an orgasm this way with my vibrator. How can I do this with my partner? There are ways to do that, and having that conversation. And sometimes I will role play with my patients to say, in a conversation, role play, to help them, give them the tools and some talking points that they can bring up with their partner. And then study after study after study continues to show that when people use vibrators, sex toys, and masturbation, that it increases their sexual satisfaction as well. I have this little note here on the bottom, right, that sexual wellness is healthcare. And that is how I view it. The World Health Organization actually has sexual activity as part of an activities of daily living. So we have to remember that this is an important part of who we are as individuals. And that it's about knowing your body, understanding your needs, and making then informed decisions and choices as well. Now, how do we even choose a vibrator? This is going to be really important here. So there's different types that we have. So something that could be used externally, we have something internally, we have dual or something both. And then we can also think about where are they using it on their body part can also be helpful. When we think about body parts, we've oftentimes, just solely think about the genitals, but nipples, earlobes, the nose, the clavicle. There are different ways and places on your body that you can actually use that vibrator as well. When we think about the types of vibration, it's going to be really important. Do you need something that has a higher vibration, something maybe in the middle, or maybe a little bit lower sensation is all that you need? Rhythm is going to be really important too. So do you want a crescendo or a decrescendo? Do you want something that's more pulsatile? And then noise and tone is going to be really helpful too. If it's going to be really loud and has a loud vibration noise to it that's distracting, we might need to find something else for you. I think capacity and how we're using it is really important. Dexterity. So some of my patients may not have as much strength or could hold something. Or maybe that their body doesn't allow them maybe to hold something in their hand. So we have to think about that piece of it. We have to think about body habitus. So, right, if somebody has maybe shorter arms or a longer torso and we're having to try to get down to the genitals, what does that look like? Can we create something that is an ease of use for them? Mobility kind of leans into that too, of how mobile are these individuals, what kind of flexibility, and do we need something that is maybe a little bit longer, or we are crafting something that has an extension to it. And then the intensity of the vibration is going to be really important. For my folks that have diabetes or other types of peripheral neuropathy, you can have neuropathy in the genitals. And so that might mean that we have to have a higher intense vibration for those individuals. And then thinking about, do you want batteries or do you want something that is rechargeable? And then we have a whole host of materials here too, something that's waterproof or water resistant, something that you could use in the bath, in the bathtub, or in the shower. Hard plastic. Typically, that's going to be a medical grade plastic. Stainless steel. Yes, you can have stainless steel ones, and I've got show and tell here in just a little bit. Medical grade silicone. Gel or rubber is something that you could use. It's not my favorite, but we have to think about price points and that we want to make sure somebody can afford something. If you are going to use something that has gel or rubber, and what I tell people too, if you open up the where the device is, the packaging in it, and it smells like you just opened up a new shower curtain, that's rubber. That's going to be kind of that chemical too that could potentially seep into your body. So we want to make sure that things are body safe for us. And so the thing that you could do with something that's gel or rubber or has an odor to it is you can put a condom over top of it, and that creates that barrier between you and the skin. Cyber skin is another one. So something that feels just like skin. So that could be a really important feature for somebody. Glass is another one. So while glass doesn't necessarily have any internal workings, some of them actually have an insertable one. So you could use a bullet vibrator to put into the end of it, or there are ones that can wrap around to create that sensation through the glass in order for increased vibration to happen as well. Let's break it down just a little bit more when we're thinking about external and internal stimulation. So the ones that we think about are bullet vibrators. So something like this one from Crave can be a great one, nice and hand tool. This is a little silicone one that kind of is a little adapter here so it can actually come off. Here's a little bit larger one too. These are all handheld, which is just, again, really nice. When we're looking at wand massagers. So those are going to be a little bit bigger. Has a more of a larger kind of head on the end of it. And so you're getting a much more broad stimulation, which could be what somebody really wants. Clitoral suction devices actually create some air pulse technology. So you can see this actually has kind of a nice like little opening here so that if the clitoris is right here, it's going to allow some like pulsatile features with that air pulse technology. And again, vibration. This one is by Suri, which is nice. And I don't have any disclosures with any of these vibrator companies. So just to let everybody know. And then when we go back to looking at our list on the external, some wearable options too. So wearable devices could be a vibrating cock ring. The pelvic people actually who create ONUT have actually created a one that actually has a vibration on here, which can be great. So this can actually be a ring that is placed over any kind of like structure. And then this part actually vibrates, which can be great. So it can be up next to the genitals as well. There's ones that have underwear and also then manual ones, excuse me. So this is a great product by Dame. So you can wear it like on your finger, which can be great. So again, if you're thinking about outside of the genitals, we have so much focus on the genitals, but if we can think about putting it on the clavicle, or again, on the earlobe, or on the nose, or along the jawline, anywhere that it's pleasurable for you or for your partner, that can be really helpful. And then the other one on here, you'll see our strokers, right? So for our people with penises, they can have devices that wrap around here as well. So this one is called the snail, right? And so again, if this was our structure, it goes in here, and then this comes over top of the end of that penis structure, and this vibrates. This will move back and forth as well. And then it also has some texture in here as well that can be really great if that is what you are looking for. So now we're looking at those internal, or these can be used dual purpose. So if we're thinking about G-spot vibrators, so for those of you that are not familiar with the G-spot or the G-zone, that's going to be about an inch in to that vaginal canal on the top part, or the anterior vaginal canal, which is kind of where what we call the crotch of the clitoris is. That is almost where these periurethral glands are, which is an area that has a lot of nerve sensitivity in that area. So this one is going to be an internal vibrator. This one is by Lilo. So again, if we're thinking about, here's my hand vagina, and it's going to go internally, right? It's going to stimulate the top part of that vagina, but it creates a curve. This is physics, right? Like this is great physics for you to be like, okay, if I just add a little bit of, movement to there, that can be really helpful. Rabbit vibrators, you kind of saw earlier, the design has not really changed with that device. So you'll see where it has internal, and then there's an external spot where it has little protrusions that are kind of tickling the glands of the clitoris, if you will. And then prostate massagers can be really helpful. So those are going to be inserted anally to help stimulate the what we call the P spot in that area. And then for partnered, you can actually have some wearable ones as well. So again, if this is something that you have two individuals that are have vulvas, and one likes more of a kind of penetrative, there is underwear and or underwear that has a harness that you can attach then any one of these vibrators to it too. So it can be a great, if somebody isn't wanting internal stimulation, there are flat ones that you can wear up against the skin, so it can just put pressure up against there also. And like we've talked about, right, vibrators aren't just for people with vulvas. Everyone can use a vibrator because everyone deserves pleasure exploration. So these are just, again, some examples of what some of these vibrators can actually look like. This is going to be the Pulse Duo. So very similar to, again, the snail one that we saw. Here's a great wearable one. As well here for you. So you can see that you could put a condom over this too. I really worry about trauma and injury to my patients. So we may make sure that we are minimizing as much as we can. These here in the middle. So this one's a wearable necklace, which can be really fun. Again, here is the one that I had shown you earlier. Again, this is stainless steel. So this is great. It's easy to actually open. And then this is where you actually charge it, which is great, right? So I am a big fan of the rechargeable ones for the environment, and they last longer, right? Nobody wants to like not have batteries, right, sitting around when their device isn't working. And then this is a wand by Intimate Rose. So these wands are great for people who have high tone pelvic floors. So if we're looking for more trigger point release, or pressure on that. I always tell people it's like having a pressure point or a knot in your shoulder, but it's in your pelvic floor. So we want to be able to release tension. And this one actually has vibration that goes along with it, right? Vibration, again, has been shown to help release muscle tension there. This one is called the Rose. It's that same technology that I showed you earlier that has that pulsatile piece here and kind of fits over the glands of the clitoris. But you could also put it over the nipples. You could put it over the glands of the penis. If somebody has had bottom growth, that's a trans man, that's another great option there as well. And then up here in the again, right-hand corner are some of our Dame products. So these are going to be, again, your silicone safe, body safe materials. But this one's really cool is because it's real bendy here on the end. So a lot of people like kind of this back and forth movement that occurs with their vibrators. So that can be really great too. And then some people like this one here because it fits in the hand really nicely. Maybe they just want to cup over their genitals as well. And then this line here in the middle is going to be the Lilo brands that I like. So like I said, with some of these, they have some pulsatile ones too. Here in the middle, it's a little bit harder to see is that hard plastic, but that can be another great material. Again, it's just what feels best for you. And then you can see some more of those devices here on the bottom. The one here on the very bottom right-hand corner is what we talked about, the wand, right? So it has this kind of a larger head on the end of it that creates a much broader option there too. And let's see. I think that was all on that one. Here are the different vibrator companies that I really love. Crave, right, is the one who actually makes the stainless steel one and has that wearable necklace that can be great. Lilo is the one that has rechargeable ones. Again, kind of that G-spot stimulator or externally. Dame, again, real soft silicone. Again, Intimate Rose was the wand. Pulse Duo, or again, like the snail one that we talked about. We Vibe is a wearable one for somebody has an internal canal. And so part of it goes in and part of it goes out. But this is another one too that I really like by the Pelvic People. And they're the ones that did the vibrating kind of ring here, but this is called the Kiwi. So this vibrates also. And if this is kind of that vaginal opening, you can kind of actually put internally. And what this is designed to do is to really help massage out those pelvic floor muscles. You can use this again for foreplay, help as a warm up, help to really relax some of those muscles. But again, could also be used as a vibrator. We talked about the magic wand is also another one that is like the Hitachi. Was a lot of people think about that in the wand category. And then the lioness, right, was the one too that connects that device. Some of the websites. So a lot of these products, you can actually go straight to their website and order them. But you could also, if you wanted to kind of pick and choose or compare, a lot of these websites are great where you can click a couple of options and be able to compare them across the board of what this actually looks like. So Belisa is great. They are a woman-owned company, which I love. The Nature Love Company is another great one. But my favorite, and again, I have no ties to this, is Wildflower Sex. And if you love Instagram, I highly recommend following them on Instagram because they have great educational videos. They have educational videos on their website. They are very inclusive and are very gender fluid, gender queer when it comes to their information. And then Pure Romance, while it may seem silly, and you might have heard a lot of people out there being part of the company and selling these products, Pure Romance is wonderful because it's Patty Brisbane who owns the company, and she does a foundation, and she is dedicated to women's sexual health research. And so she founded this organization, this nonprofit, and I forget how much percentage of her profit actually goes to this nonprofit. And so really highly encourage you to look into that as well. And we've talked about this multiple times, right? That vibrators and sex toys are for anybody. And if you're thinking about your gender diverse individuals, or if this is how you identify, when you are going to look at toys or vibrators, think about it based off of your anatomy and what your need is and what your want is. So don't think about the marketing labels or because something says it's only for penises or if it's only for vulvas. That's not true. You can use it again for anywhere on any body part. The other fun thing too for a lot of these products is you want to remember too that like stretch and be creative and adaptable, right? So I have somebody who really loved this ring and they were like, I love it on my partner, but can I use it for other things? And I was like, absolutely. Again, you can use it here in your hand. This sucker is nice and stretchy, so you can actually put it on your wrist, right? So again, you could put it on your foot if you wanted to, around your ankle. There's, again, be creative and really try to think outside of the box can be really helpful. So here, just as like to wrap up, I always tell people, right, it's your pleasure and it's your rules. When you think about hygiene and your vibrator care, every company's gonna have a little bit different option of what they can do. But for the most part, you can clean your product off with warm water and an antibacterial soap like Dial. Whenever you wash it and clean it off, you want to make sure that you keep it out, that it fully dries before you put it away in your cabinet or in your drawer, in your bedroom or in your bathroom or in the kitchen, wherever you want to keep yours. But that's all that you really need. There are several toy hygiene products out there, like cleaning ones, but it's not always necessary, so you don't have to worry about it. Lubrication is also really important. You have to think about if you want a water-based lubricant, silicone, or a hybrid. And when we're thinking about what is going to be safe with toys. So silicone lubricants with silicone toys can actually break them down. So we want to be really careful about that and maybe want to use a water-based lubricant for those types of toys. Although some people and some providers will say you can use a silicone lubricant because it's great and it's really nice and slick. But as soon as you are done using it, you go and wash that toy. And so that silicone lubricant isn't sitting on there. And that potentially that could help to avoid any of that breakdown from happening. And then it's always important for us to talk about communication and consent, right? Anytime that we're talking about sexual play and engaging in somebody else's body, we want to talk to them. We want to talk to them ahead of time of being naked. That is really what's going to be important. And that just because something was done last week doesn't mean that that same thing is wanting to be done this week. So again, talking, communication, and consent. And then thinking about overcoming shame and stigma. Many of my patients have experienced this, an embarrassment, or come from an upbringing where touching yourself or sexual exploration was not something that you did, let alone like talked about. And so really trying to overcome that. And that can be a really helpful and again, empowering tool for that individual to again, be okay with having exploration and what does this look like. And you don't have to go straight to the genitals. Oftentimes, if I have somebody who's really hesitant but like excited about potentially exploring this, we will talk to them about just getting a very basic vibrator, right? So one of like these little bullet vibrators can be great. And what I start having them do is we start exploring non-genital, non-breast areas of the body that they can just go, how is this feeling? What do I like about this? Do I like this sensation? Do I like this vibration? So again, it could be on your wrist, could be on the clavicle, the inner thigh, backs of the knees, the buttock area. So again, it doesn't always have to go straight to the genitals. We talked about where to shop when you're purchasing your product. I like to go local if I can. So think about where some safe places are in your local community. Those companies and those businesses tend to have staff that have been educated. That was one of the big things for me when I was looking at referring my patients to a place. I wanted to make sure is, are they going to be inclusive? Are they going to be warm, welcoming? And what does that experience look like? If you are a healthcare provider listening to this podcast, which I hope you are, I encourage you to also go to those stores and see firsthand what you're referring your patients to. And then questions when to consult a healthcare provider. If you start having pain when you're using one of your vibrators or toys, please reach out to your healthcare provider. If there is an odor or an increased discharge, that would be another thing to actually talk to them about as well. Or if you have any questions just about your body and the use of a vibrator, great place to go and have that information. And remember that your pleasure journey is uniquely yours, and be authentic and awesome as whatever it looks like for you. And then this is my information if you wanted to search the Fosnight Center or follow me on social media.
Awesome. Oh my gosh. Thank you so much. That was so great. It's like, and that's what we try to tell people. You presented the science of vibration, the science behind it all. And that's what people don't always understand is there is research, there is science, there's really good information, and there's also lots of fun too. And I think you did a nice job of balancing all of that, Aleece, of course. You're such a great advocate for patients and for positive sex. So I really loved it. It was just great. Yeah, and I think exploring, especially because I think a lot of people think of it more as a solo thing, but there's so many things that you can do together. Um,
Mm-hmm.
I I use a lot of rings like the one you had where the vibrator it can sit on top and hit the clitoris and male. Yep. And
Mm-hmm.
just great stuff. Flat vibrators that you can put between and vibrate genitals simultaneously, right?
Yeah.
There's so much fun things that you can do. And I also love, I know you use Masters and Johnson Sensate focused a lot too. And so and again, there's these stages. And what we do is we step back away from genitals and breasts and we kind of start over and are like, have you ever like explored the rest of your body, your non-genital, non-breasts,
Yeah.
right?
Yeah. I know it's so much fun because they look at you with this like curious, like, I can do that. I'm like, you can do whatever you want. Like, and to see that excitement, again, it's that permission giving. And I think that it's, like I said, too, it's your pleasure, your rules. So whatever feels good for you and how you want to incorporate that, that can be great. As long as, again, there's communication, there's consent, and that safety is the
Mhm.
biggest thing that we were looking at that too.
Definitely. And again, I think releasing the stigma, the shame, the whatever, explore everywhere, because I think oftentimes people think, well, sometimes heterosexual males are like, but you don't want anything around the anus or the rectum. But then there's a lot of there's a lot of points there that are very stimulating for heterosexual, homosexual, whoever, right? So it's just kind of seeing where is it on you? Like you said, the inner thigh is a spot. Maybe it's the back of your neck.
Mhm.
Who knows? Your earlobe. Um, I think it's
That's a
fun.
fun one that people don't realize, that earlobe. That's a good one. Yeah.
I think so for sure, for sure, for sure. Okay, I have my first question for you. I thought it was a good one. They said, my partner feels uncomfortable or insecure about me using a vibrator. How can we talk about it without creating distance and kind of bringing us together around it?
So I this is a wonderful question. And the way that I would respond to it is be curious, right?
Mm,
And going, I would love to understand a little bit more about why you don't want me to use one or where this is coming from. Can we talk about it a little bit more and can we come up with it? Most of the time it can be an insecurity.
mhm,
And because they're thinking that, oh, I can't please my partner is going to be the biggest thing. And that's definitely one thing that we want to debunk is
mhm,
it is not about right who can do it better or it's not a
mhm.
competition with you and the vibrator when it comes to that partner. Oh, and that oh my goodness, right? And so,
Right.
that can be and again, opening up that conversation of going, well, here's one of the reasons that I really like to use the vibrators because I'm thinking about you when I'm doing it.
Mm,
Or I'm
mhm,
thinking about how we could incorporate maybe the vibrator into our sexual play. What do you think about that? And so having that curiosity lens rather than being more defensive with
mhm,
it is going to invite more curious conversation, more productive conversation. And if that is something that you're still struggling, I would invite couples therapy, have a mediator, right? That can be really helpful. That way, it's not you going up against the other person. You have a mutual kind of neutral person that's there, can talk about and bring up potentially what might be going on. That partner may, again, feel embarrassed, or it may have been a family value or a message that they got growing up that was like, you aren't a man if you're, again, in a heterosexual way of you aren't a man if your partner is having to use a vibrator. You can't satisfy her. So
mhm.
again, it's like, where is this coming from? And helping to break down that piece of it can open up that. But sometimes it's hard for you as the partner. So again, inviting somebody in to have that conversation with you can be helpful.
What a great conversation to have though, and
Mm,
explore and learn more about your partner. Because where does all that come from? And I think a lot of people, it comes from a place of, "Well, that's like a replacement for me.
right.
You like that better than me." And it's like, "No, this is something to really enhance our love play together. Nothing will ever replace you." Right? And
Right.
so
Right.
I think but all of us need reassurance because we so wrongly always think it's about me, but it's not. Most things are not about they're it's not about you, the other person. It's about the person who's experiencing it and what their
Mhm.
needs and wants are. So I think opening up that it's such an important thing. Maybe just starting the conversation with there is nothing I want more than you. And this is just something to enhance our love play together. Nothing will ever replace you, you know?
Mhm. Yeah.
But I think it and then too, what a great way to start conversations and understand about your partner. So I love that. That's good.
Well, and then like I said, that could be you bring it in as a partner play. And so that can be where you can say, "Why don't can I go get the vibrator now? You want to try it?" Because a lot of
Mhm,
times it's also like, well, maybe because again, I am who I am or whatever else, maybe I don't feel like I have the right to use a vibrator or I don't even
mhm,
know how to use it. So inviting that person into just like, hey, do you want to hold it? Do you want to see what this is? Do you want to see what the vibration? Again, creating less what do I want to try to say? Like questioning or like that like breaking down the unknowing, I guess is
mhm,
kind of the biggest thing is sometimes they just don't even know what that is and how they're
mhm.
using it. So
And two, I always teach patients, and I'm sure you do too as well. We're all responsible for our own orgasms anyway,
yep.
ultimately. No
Oh,
one else
yes.
the greatest lover is the one who can listen, learn, and be attentive because you're still, we're all responsible for our own orgasms, period.
Yes, absolutely. Yes.
So I think that's a really important point. This other question someone answered earlier, you had a lot of good thoughts about this, but if you want to go a little further, are there any health or safety concerns I should be aware of when using a vibrator, when using vibrators, especially for people, this person had some pelvic pain or, some pelvic dysfunction and hypertonicity. And as you said, it can help with that. So I thought maybe if you could expand on that a little bit.
Yeah, absolutely. I don't think that there are any, yeah, I'm trying to think of, are there any contraindications? Right. That's what I always think about, right? Is there any contraindication to using a vibrator? I'm like, I can't necessarily think about one
Mhm.
in particular. And so, right, you're exactly, correct on pretty much anybody can use it. It really helps to decrease the tone if somebody does have a high tone pelvic floor or a tight pelvic floor. And right, tight and strong are not the same, they're not interchangeable. I always think about, tight shoulders, right? You can't really go do anything or that sort of thing. So being able to have nice neutral relaxed muscles so that they can do what they need to do, so that can be really helpful there. But yeah, I'm not really thinking this is again a great tool for anybody. You just got to get creative. So if you're thinking like, how could I use this, with my body? People who might have a disability, or again, the mobility piece of it. Again, there's great ways and stands. So there are suction cups that you can put on the wall or a headboard or a floor, or Liberator has a great pillow that has an insert in it, so you can actually like stick one of the vibrators in it so it stays, and then you could scoot yourself up or have somebody help you. So again, the amount of options that are out there for you is so vast. But yeah, I don't think that there's any contraindications. If you have an active infection, I would say maybe like a vaginal infection or a urethral infection, potentially, or a skin infection maybe. But
Yeah, that
yeah,
was, and so the couple things that come up with it, for contraindications, and they're not hard contraindications, are open wounds, sores, or infections
sure.
in the
Yeah.
genital area potentially. And again, check with your provider because you need to see what they think. Post-surgical healing after genital surgery, pelvic surgery, and stuff. Severe pelvic pain or undiagnosed pain, neurologic disorders with reduced sensation where you might not be able to feel if something was wrong. And
Mm-hmm.
again, just check with your provider. And lastly, with implanted medical devices, sometimes pacemakers, neurostimulators, stuff like that, it can be safe, but you might want to just check with your provider is what it says. Those are not hard contraindications, but those are the only things that really come up. But
Mm-hmm.
yeah, great. And then, like you said, it could be healing, especially for the hypertonicity, and work with your pelvic floor physical therapist or your healthcare provider to see in what ways you may be using electric stimulation or pelvic floor physical therapy, but this might enhance and might be something to explore.
Mm-hmm. Yep, absolutely. Thanks for that whole list, Jeff. Thank you.
Yeah, I just I just pulled it up real quick to see. Yeah, is there? And I knew there were no hard ones, but yeah, interesting everything. But anyway,
Yes.
um, it's such a fun subject and so much good information. I really, really love it and appreciate it. I'm going to come back and see if you have any final things you'd like to share as we close out. But first, I always end with a closing centering exercise, and I'd like to do that now with our audience. And so, as we always do with the podcast, let's close with a moment to reconnect with our miraculous selves. Find a comfortable position, seated or lying down. Let your hands gently fall to a rested position that's comfortable. If you feel safe, allow your eyes to close. Take a slow, deep breath in your nose and exhale gently through your mouth. Continue that breathing pattern as you let your body soften. Let your breathing pattern steady, a slow, deep breathing pattern. Let go of any tension or any judgment and just be in this moment. This is all we have, this moment right here. Now, bring your awareness inward and reflect on these gentle affirmations. They're already formed. Why is it so safe for me to explore what brings me pleasure? Why is it so safe for me to explore what brings me pleasure? I deserve to feel connected to my body and its desires. My pleasure is valid. It's a beautiful part of my health and well-being, and I am more than worthy of pleasure. I am worthy of love and belonging, and I am enough. With your next breath in, imagine curiosity. I love that Aleece talks so much about be curious, curiosity and self-compassion. Imagine that filling your whole body, that curiosity and self-compassion. And as you exhale, release anything that tells you that pleasure isn't for you, because it is for you. Take one more deep breath. And when you're ready, gently open your eyes. Carry forward this openness, this curiosity with you as you continue your journey. Vic, can you show us what's up next week on Dr. Jeff Talks About Sex and Intimacy?
In this episode, Dr. Jeff is joined by Christina Saldanha, physician associate, certified sex counselor, and yoga teacher, for a rich conversation about the intersection of sexuality and yoga. Together, they explore how yoga can enhance body awareness, foster emotional connection, and support healing from sexual trauma or dysfunction. Christina shares how breath, movement, and mindfulness practices can deepen intimacy and pleasure while helping individuals reconnect with their sexual selves. Whether you're new to yoga or already on the mat, this episode offers accessible insights for integrating yoga into a more embodied, joyful approach to sexuality. Join us on June 24th at 7 p.m. Central Time to learn more.
I'm so excited to have a sexual health and yoga expert on again. We had one before, and we're going to have one again. It's just going to be so cool, and I can't wait till next week. But Aleece, oh my gosh, it was so great. I love all the science. I love that they see how far it goes back, and that there really is research to show that this could enhance your pleasure, either on your own or with your partner. So, any final thoughts or messages for our listeners today?
Yeah, absolutely. So when I'm thinking about vibrators, I want you all to remember that this is just a tool, right? It is just a tool to enhance your pleasure, create more exploration and connection with yourself and with your partner, and that there isn't any right or wrong way to actually use them. It's only what feels good in your body and how it is using to empower yourself, not just in your sexuality, but just again in who you are as your identity and just your being. And I'm going to continue to say to stay curious, because I think it's one of those really important things that, again, creates leaning in to something that may feel a little scary, and that listen to your body, listen to what you might want, and giving yourself permission to enjoy the journey.
Aleece, I can't imagine anybody doing a better job with what you presented. You did such a phenomenal job, and you're such a caring, loving person, and you have such a welcoming to all genders, to all relationship styles, and I really love your approach to things. So thank you so much for being with us, and you have a wonderful evening. And to our listeners, thank you. None of this is possible without you, and this is all for you. The only reason we're here is to help you and give you the information you need to enhance your sexual health and your relationships. Have a great one.